Hi, we're here in Las Vegas at HFMA ANI 2014, and we're here with Travis Mendenhall, Senior Systems Analyst with Gwinnett Hospital System in Atlanta. And Travis presented this morning to a pretty packed room, best practices for simultaneously increasing patient collections and satisfaction. And Travis, could you give us a summary of what you were discussing this morning?
Sure. Well, we were talking about the very difficult job of having to enter a patient's room and have a discussion with them about what their bill is going to be.
Right.
And also the process of letting people know in advance for scheduled visits so that they're not surprised by the bill on the backside.
Right.
And even though it's a difficult thing to do and no one enjoys that visit, not the financial counselor having to do it, nor the patient receiving it. And I think most of us have been in that situation and know that visit's coming because of what we do. And we despise it when it happens to us. So we talked a little bit about introducing processes and technologies to help make that a less painful process. And someone after asked, do you get any pushback from an administration that you do point of service collections like that? And really, in today's environment, you have no choice as a hospital. You've got to do that. And there's no good time to have that conversation. So we believe that earlier is better. The earlier the patient's informed of what we expect them to owe, the more time they have to process that and to think about alternatives, payment plans, some sort of arrangements. So from the technological standpoint, why that's important, we really needed to introduce bill estimation that could be done in real time based off CPT codes or a run of a patient's benefit, so that on the very first contact with that patient, once whatever they were doing had been ordered, we could give them that information right away.
Right.
So it was an opportunity to discuss RevRunner and relay clearance, what that's done for us. The added benefit really comes from the patient accounts world most recently, but we like it because it gives us a defensible, repeatable estimate. So the patient may say, hey, I was told this amount. We can go and look up right then and there, oh, that's exactly what you were told, or I don't think you were told that because it says you were told this. Mm-hmm. And here's your estimate right here, and it's printable and reproducible. So that was one thing we talked about. We also talked about the optimization of our online portal, both for the patient and for the provider portals. And what that's done for us, we went live with that about 3 years ago. And in the beginning, well, it did some great stuff for us. We had a 10% drop in abandonment rate on our customer service phone calls, inbound calls. So clearly we were very high. If you could have a 10% drop, we were up there. And that was overnight. So wow. People immediately were waiting for that tool to be out there and began adoption right away. So we've got almost 30,000 people enrolled, and then we've got a lot more people who pay without enrolling. So I'll tell you, to be honest, in the beginning, we weren't crazy about the website. We had a long wish list of things we wanted. We were basically going to Visa and Sally Mae and saying, what can I do here and how come I can't do it here? And we had an optimization that was really sort of magnificent, where all of the programmers came out. I don't know if it was all the programmers, but about 15 programmers came to our patient accounts department and rotated out of a holding area to come watch our customer service reps take payments and to talk with them about it. And they put calls on hold and turn around, and they were not shy. They put in all their little complaints about it, and those guys sat there and wrote notes. And when we walked away from that, there was a lot of skepticism about whether or not anything would ever happen. And it was a constant trickle of improvements. You know, it's the best experience I've ever had with a company actually listening and responding. A company this big, you know, it's change is slow. I mean,
Sure.
It's so slow, and then the RA2 product came out, and every one of our wish list items was rolled up in that. And they remembered, you know, that when they came back to us, they said, look at this. You gave us all these points, all these wish items, and here they are. And then, so now we went back and went, well, what else can we throw in there? You know, so we're really getting creative at this point, but it's a great relationship.
Good.
It's worked out nicely.
Great. Now it's certainly easy to measure the impact when you're talking about the collections. How are you going about measuring customer satisfaction?
Well, 40% of our payments are now taken online,
Okay.
of our patient payments. So that's pretty big. That's a lot of adoption. So we know that adds convenience. You're not having to write out a check and pop it in the mail. It's a lot easier. In the rooms, we're taking iPads up, and our roaming financial counselors are able to not only take a payment by the bedside, which eliminates them having to leave the room with a credit card in their hand and go to a swiper at a nursing station, which doesn't make anybody happy that you're leaving the room with their credit card. They're also able to toggle through. They're also able to toggle through other accounts and talk about those accounts on the spot. So, you know, whether that makes the patient happier to know about other bills they may owe, I'm not sure, but at least if they ask that question, they're able to answer that on the spot, saying, you know, if you could call patient accounts and ask them, that'd be great.
Probably lessens the administrative burden as well on that.
Absolutely, because they're now we're not batching a separate credit card. Any point of service payment taken anywhere can be applied to a particular department or T code by that user. So I'm taking this payment from the pre-auth department. It's going to apply the correct T code for that to post and give credit to that if that's what you want to track. And it's all in one file that you upload, no matter where the payment source was.
So if you had a recommendation for a health system or hospital that wanted to implement this sort of system, what would you recommend as the first step?
The first step is assess whether you need to have your statements also changed, your paper statements. Do you want to go in on that separately? And then, or do you want it all wrapped up in one company? You're dealing usually with the exact same file set, so I think you probably want to keep it together. I think that's a good place to start. And identify what you want your site to be. You know, go out and find another site that's your dream site, and then go shopping and compare it up against the products that are out there, because you really don't, these days, you really don't have to build this stuff from the ground up. Right. Other people are figuring it out for you. You just have to find it and see if it fits.
That's right.
As far as the clearance side, hopefully you're going down the road of automating your insurance verification, benefit verification, your price estimates, and also your payment portal, and you want all those things wrapped up in one product. You don't want to have to be toggling around to different things.
Don't want them siloed.
That's right, because they all need to talk to each other.
Right.
So if you're shopping, you know, don't settle, because there's some good stuff out there.
Great. Well, thank you for taking the time to speak with us.
Absolutely, my pleasure.